Hey everybody, for those of you who don't know me, my name is Palumbo. I'm an orthopedic surgeon at OAA. I've been working in sports medicine for 25 years. For those years, I've seen lots of changes in the healthcare system, and not always for the best. It's no secret that there are some very serious problems with the current state of our healthcare system. Problems that are hurting our economy, driving out doctors, and most importantly, depriving patients of the medical care that they deserve. There's a bunch of reasons for this that are complicated to discuss and difficult to understand. Lack of price transparency, consolidation of top-heavy hospital administrations, overreaching insurance providers, burdensome regulations, wasteful spending, and political gridlock are just a few of the many factors that have the healthcare system in America increasingly overpriced and overburdened. But for right now, I want to talk about problems that we could solve together. We don't have to wait for some major institutional overhaul to start making things better for ourselves and our loved ones. There are ways that we, as a community, can actively take our health into our own hands and drastically alleviate the burden on ourselves as individuals and our healthcare system as a whole. That's why today I want to talk about obesity. The CDC reports obesity is one of the biggest drivers of preventable chronic diseases and healthcare costs in the United States, and the key word here is preventable. Between $147 and $210 billion a year in healthcare costs are associated with obesity. As a person's BMI or body mass index increases, so does the number of sick days, medical claims, and healthcare costs. Obese adults spend 42% more on direct healthcare than adults of a healthy weight. Almost more importantly, obesity in children increases the risk of heart disease, adult onset diabetes, and cancer as an adult. Obesity was considered rare in children about 30 years ago. Over the past 2 decades, obesity in children in the United States has almost doubled from 15% to 25%. Reducing obesity, improving nutrition, increasing activity can help reduce costs, lead to fewer doctor's visits, tests, prescription drugs, sick days, emergency room visits, and hospital admissions, plus lower the risk of a wide variety of diseases. The last 5 years have been pretty hard for me from an orthopedic standpoint. I've had 8 orthopedic procedures, which have resulted in bilateral partial knee replacements, a right hip replacement, 5-level lumbar fusion, and a 4-level cervical fusion. Over the past year, I've been slowed down, especially because of my cervical cord problems. My fitness level has suffered significantly, and I've gained almost 40 pounds over the past year and a half. So, I know as well as anybody, taking control of your own healthcare isn't easy. We all have our own reasons, and I'm no exception. But if we support and encourage each other, I truly believe that this is an issue we can tackle together. That's why the OAA Sports Medicine Foundation is announcing the start of our U25 program. BMI, or body mass index, is really a simple way of saying what the percentage of total makeup of the body fat tissue is. This is a very important concept because we know that above a certain percentage of body fat, there's a higher incidence of diseases, including hypertension, diabetes, heart disease, and certain cancers. The BMI has been used to categorize whether an individual is at a healthy percentage of body fat or whether the patient is at a percentage of body fat that increases the individual risk. There are several ways to calculate the BMI. The most common method is calculation using the individual's height and weight. Many of you have seen these charts in your doctor's offices, since the BMI has become another vital sign that is recorded in your doctor's chart of you. According to the World Health Organization, those of a BMI between 18.5% and 25% are in good shape and not overweight and in a good healthy weight. Between 25% and 30%, an individual is considered overweight. Above 30%, an individual is considered obese. and there are varying degrees of obesity, including up to over 45% being morbidly obese. There can be significant problems by using the method because the chart is calculated using a very generalized body type and doesn't take into consideration the patient's frame or muscle mass content. You can have a very out-of-shape individual, poorly conditioned, where his BMI is significantly underestimated. And you could have a very fit, very muscular individual where the BMI is severely overestimated. This can become very important when trying to determine the patient's risk, but also when determining a patient's progress during a fitness program or a weight loss program. Still, the use of the BMI gives a more accurate picture than simply following weight loss. Weight loss can be secondary to muscle mass loss rather than just fat loss, and this is important to determine. At OAA, we use a very special piece of equipment called the Bod Pod. The Bod Pod uses a technique called air displacement to determine one's BMI. This is one of the most accurate measurements of body composition and takes only minutes to perform. This method absolutely takes into account muscle mass and body type and provides an incredibly accurate picture of percentage of body fat, or simply put, BMI. This is one of the best methods for following the progress of a fitness program where one wants really to get down to a healthy body composition, and it takes a much better picture than using the weight loss and simply stepping on a scale. We have been using the Bod Pod for research and weight certifications for wrestlers, and now we offer it to you as well. For a donation of $75 to our Sports Medicine Foundation, you can have a Bod Pod test performed that will let you know where you stand. I'll be posting a video of my Bod Pod test soon, so you'll actually be able to see what it's all about. It's not going to be pretty, and you'll see how simple the method is. You can follow my progress on the OAA Sports Medicine Foundation Facebook page, Instagram, and Twitter. This will also be the way you can share and let us know how you're doing. For those of you that go from a BMI above 30% to a BMI below 25% and maintain that progress for at least 3 months, you'll receive our OAA Foundation U25 t-shirt, and we will be happy to share your accomplishments on our newsletter and our Facebook page if you give us permission. Obviously, this is a way to surround myself with a support group and additional incentives to get myself below 25 BMI. Help us bring attention to and help alleviate the obesity epidemic in our community. Literally solving this healthcare issue would lower healthcare costs significantly in the future. Be a part of the solution and join the U25 program. I look forward to taking the journey with you. Thank you.